Hi, I'm Dr. Jill Salyards. I'm a board-certified dermatologist and founder of Refine Dermatology here in Knoxville, Tennessee. And today I want to talk about melanoma. What is it? How do we diagnose it? What to expect? And most importantly, how do we prevent it? Melanoma is the most serious type of skin cancer. It develops from the pigment-producing cells in the skin called melanocytes. And while it's much less common than other types of skin cancer, it is also more aggressive. And this is why we harp on early detection being so important. The good news is that if it's caught early, it's very treatable. And so one of the best tools we have for early detection is something called the ABCDEs of melanoma, which I review with all of my patients when they come in for a skin check. So let's go over those. We'll start with A. This stands for asymmetry. This is where one half of the mole doesn't match the other. The second is B, border irregularity, where there's uneven edges or irregular borders. C stands for color variation, where there's multiple colors or an uneven coloring in your mole. D stands for diameter. Typically, we say larger than a pencil eraser, which is about 6 millimeters. You can take this one with a grain of salt because you can have small moles that are bad and large moles that are fine. So you want to look for some of these other criteria as well. And then finally, E, which stands for evolving. And this is any change in size, shape, color, or symptoms of the mole. I also talk a lot to my patients about the ugly duckling sign. And this is just a mole that looks different from any other mole on your body. And honestly, if a spot is changing, it looks different, has symptoms like itching or bleeding, it's just a reason to have it checked. So what happens if you come in? If you come in with a concerning spot, we're going to take a close look at your mole, typically using a dermatoscope. And this is a tool that helps us evaluate structures more clearly in the skin. And if something looks suspicious, we'll perform a biopsy. This is a quick in-office procedure. We'll either remove a small sample or sometimes even the whole spot, and then we send it for pathology. Most biopsies heal very well and quite quickly, and they're going to give us the information we need to make an accurate diagnosis. Results take typically 1 to 2 weeks, and we will always review those with you. So if a melanoma is diagnosed, what's the next step? So the next step is typically going to involve just a surgical excision to make sure we completely remove the area. In some cases, depending on how deep the melanoma is, additional testing or treatments might be needed. The prognosis is largely based on the depth of the lesion. So the deeper it is, the higher risk of spreading, and this is going to help guide whether or not things like a sentinel lymph node biopsy are recommended. But again, when you catch them early, outcomes are very good. Prevention is a huge part of this conversation. The most important things you can do are wear a broad spectrum sunscreen of SPF 30 or higher every single day, reapply every 2 hours if you're outdoors, wear hats, sunglasses, and other sun protective clothing when possible, and at all costs, avoid tanning beds. And just as importantly, you should be doing regular skin checks at home every month where you're focusing on making sure you're checking your back, the back of your legs, and the bottoms of your feet because those are areas you never see. And then also, it's a good idea to come in for routine skin exams with a professional. I recommend that most adults get a baseline skin exam. There's no real recommendations overall on what age that is. And then you should have more frequent skin exams if you have any risk factors like a history of sunburns, a lot of moles, or a personal or family history of skin cancer. So the key takeaway here is that skin cancer is one of the very few cancers we can actually see with our eyes, which means we have a real opportunity to catch it early, and early detection is key for a best outcome. If you have a spot you're concerned about or you haven't had your skin checked, we would love to help you. At Refine Dermatology, we focus on thorough, physician-led skin exams so you feel confident and cared for. I hope you enjoyed this video and I hope you learned something, and remember to get your skin exam. Thank you so much for watching.